Hi, my name is Conrad. I'm happy to be here today. And I always say officially diagnosed with cystic fibrosis when I was 38. However, it's an interesting journey I've had because I actually was diagnosed in infancy at 3 months old, and then the diagnosis was taken back. And so I am happy to share with all who are listening kind of that journey.
My name is Julie Carroll. I'm 71 years old, and I was diagnosed with cystic fibrosis at age 67.
I'm Jeannie Hanley. I'm now 64, and I was diagnosed at 33.
Hi, my name is Laura Mensch. I am 73 years old and have had my diagnosis of cystic fibrosis since I was 50. Yet my journey with CF started a very long time ago.
Um, so I was born in 73. I'm 52 years old now, and in a small rural town in Nebraska. Um, when I was born in September, and then on Christmas Eve of all days, I wasn't breathing well, and so my parents took me to the ER. I'm their firstborn, also. And they had placed me in a croup tent for 3 months. Actually, I couldn't go home because there was some just really bad infection and in my lungs and sinuses. They did a sweat chloride test, and the it came back abnormal naturally. By the time I was 3 or 4, I had tonsils and adenoids taken out. I don't know if there's any correlation there, but I began thriving. As soon as I started thriving and breathing fine and things, my parents were just kind of scratching their heads, wondering what's next. And the doctor said, "Well, as long as he's doing fine, I guess maybe he's an asymptomatic something or other, just an anomaly."
I'm the youngest of 5 children, and I was sick right off the bat as a child. My mother wrote in my baby book that Laura's a sweet little baby, but she's sick all the time. When I was first born, I had a lot of stomach pain as an infant. She said, "Your little legs," she just pulled your little legs up and screamed. And she was told to stop breastfeeding me. They said it must be your milk, which is pretty shaming to a mom who's been a successful nursing mom for 4 other children. But it started then.
I started having symptoms at a young age with just really frequent sinus infections. But my story or my path to diagnosis kind of started with it's really a story about my family. Four of us would end up being diagnosed with cystic fibrosis. And it was really about all of us. My sister was a year older than me. She was always the sickest. She had pneumonia, sinus infections, hemoptysis, hospitalizations. By the time she was a teenager, that was all happening while I was just having my sinus infections, and I considered myself very healthy, And but my two older sibs also had pneumonias and sinus infections, and also my brother would suffer flares of pancreatitis.
For the most part of my life, I was healthy, physically fit, and active. I had chronic sinus infections. I had respiratory infections that resolved with trips to urgent care. Um, I had allergy shots that I took for 20 years. My digestive system was the most problematic. And when I talked to my doctors about that, they told me to eat more fiber, drink more water, and that there was nothing wrong with me.
So I went along um, through my childhood with little to no problems. However, looking back, there were a lot of telltale signs there. One in particular is I had horrible sinus headaches and sinus pressure. And I don't hold my parents responsible for this, but perhaps they might not have been proactive in certain aspects as much as they could have been to see why some of these chronic things were happening, such as my sinuses. But for whatever reason, we just went along. Of course, I did grow up around a lot of smokers. And so That was attributed to perhaps some of it, um, but congestion in the lungs started increasing more and more in my adolescence, and of sinus infections. Every cold would hang on forever.
My parents made so many accommodations for me. I feel very lucky that the family I was growing up in, they treated me like a normal kid. Um, all the way through, all the way through my childhood, even though I was sick a lot. The pediatricians sent me to an allergist. I have to think I was 4 or 5 years old, who did all those scratch tests on my back and determined that I was allergic to all sorts of things and started allergy shots first 3 times a week, then once a week, then every other week, then once a month for my entire life. Um, and that was the plan. Once I was locked into an allergist, I don't think anybody saw beyond that. Asthma, sure, because that can cause bronchitis. And I started to get bronchitis, by seventh grade. And then I would get bronchitis every other year. But everybody treated me as if that was asthma related.
So my sister, Teresa, who was a year older than me, she was one doctor did a sweat chloride test early on when she was like 5 or 6, and it was negative. So that diagnosis was never considered again. And but I wanted her to be well, so I decided at a very early age to become a doctor because I wanted to figure out what she had. I wanted to cure her. I was so sure. Anyway, so on my path to the diagnosis, I did go to medical school and pediatric training and allergy and asthma specialty. And during that time, it kept on popping up, these situations in class or with patients, or where there was discussions about cystic fibrosis. And I just thought, oh, God, it sounds like my whole family. When you put us all together, the severity and GI, respiratory, and we just couldn't. But there was no way to diagnose it. Instead, I was diagnosed with asthma and something called ABPA, or allergic bronchopulmonary aspergillosis. And so I ended up getting tons of steroids, and from my 20s all the way, really, for a very long time.
Right around 30, I had a bout of pancreatitis, and they took my gallbladder out first thing, even though there weren't gallstones presenting, which I did okay for about a year. Then I had another acute attack of pancreatitis, followed by 4 more consecutive attacks in a row, and being hospitalized for that, one after another, which was just no GI doctor I saw in Minnesota could figure out why, because there was no other things that I was doing lifestyle wise that could have contributed to that. So the doctor I finally saw did an ERCP with an endoscope and resected the pancreatic duct. So he diagnosed it with, actually, it's called sphincter of Oddi dysfunction, kind of a funny term, diagnosis name. But basically an abnormality in my pancreatic duct that was, for whatever reason, not allowing the enzymes to release, and so causing inflammation of the pancreas.
My symptoms started to worsen as I got older, and my gallbladder stopped working in my 50s. Then at age 61, I had my first episode of pancreatitis. I was never a very successful drinker because alcohol made me sick. So when I got to college and drank to try to fit in with with others and try to make new friends, I became the puker of the party and was not popular at all. It wasn't a good way for me to make friends. And you can imagine my surprise when I was labeled an alcoholic that first time in the ER. Over the next 3 years, there were 5 more episodes of pancreatitis, and nobody bothered to find out why.
At many points during my training, going through all this, I had asked doctors about it, and I was literally, it was just dismissed in many ways, either laughed off or just told, no, no, you're too old, your family's too old, wrong, you're the wrong ethnicity, and there was just really no way to test it. So I got my first break really when I was like 31, and I was in allergy training, and I went to a conference. And so this is 2 years before my diagnosis. And I happened to meet a trailblazing physician scientist, Dr. Rick Moss, and I was able to ask him about my family. And he said, and he was the first person to give me encouragement and said, you should have everybody tested. Now, mind you, this was 1993. And genetic testing, the gene had just been found in 1989, and genetic testing was pretty new, and they were only checking for 6 mutations in the lab, at the medical center where I worked. So anyway, I swabbed everyone's cheeks in my family, and I sent off everything, and lo and behold, it came back that we had one mutation. And all the people who had mutation were all the people who were sick, plus one other sibling and my mother.
In my 40s, I got a lot sicker. I had moved from to a high altitude, which I thought that's why I was sicker. And I would get coughing fits then. So, and I would accommodate to that by always carrying water. And then if we were at a theater or my kids' concerts, that I would sit on the aisle. So if I had a coughing fit, I could get out of the auditorium easily. And those are the kind of fits that make people around you worried. Yet I kept getting treatments for bronchitis all the time. But I did have 3 children. And after my third child was born, I forgot to get my allergy shots. I was a graduate student. I had 3 kids. And guess what happened when I had my allergy shots? Stopped them. I forgot. Nothing happened. I just forgot to get them, and nothing about my health changed.
Meanwhile, in 2019, I had sudden and severe diverticulitis, which resulted in a colostomy, then an ileostomy, a third surgery to close the ostomy, and a fourth surgery for complete abdominal reconstruction. This all occurred within 17 months and all during the pandemic. The infection that time was so severe, the first time, that it somehow wrapped itself around my left ureter, necessitating a stent, and also caused a rectal vaginal fistula.
So for the most part, I went along okay throughout the rest of my 30s with occasional flare-ups here and there, but no acute attacks. Um, as I was singing more in choirs and things, I had troubles with congestion and sinus drainage problems or lack of sinus drainage. Anyway, that started my odyssey, if you will, into diving to find out what are these, what's going on here. Never connecting pancreatitis or the sinus headaches I had when I was a youngster. None of those were really connected, but I started with an allergist. And so I had the pricks on the back that they do to test for allergies, and I had a few. And so I started the immunotherapy shots. Maybe they helped somewhat, but obviously wasn't addressing the root problem. And so I went from an allergist to an ENT, where sinusitis was diagnosed. I had a surgery, followed by 4 more surgeries for a total of 5. But after the second surgery, the ENT doctor thought that there's more than just sinus drainage going into your lungs. There's something going on with your lungs as well, because after surgery, they pull out that tube from your throat, and it was just covered in gunk. And so then he bounced me over to the pulmonologist, who did a CT scan of the lungs, bronchiectasis, and then another sweat chloride test, of course, abnormal. And at that point, I was 38 years old. I later on called mom and dad at home and said, hey, guess what? I have cystic fibrosis. And Now, keep in mind, they had never mentioned this to me ever. I knew that I was sick as an infant. I was in this croup tent. That's it. That's all I knew.
My parents passed in 2001 and 2002. By the next spring, I had been treated persistently through the year with Cipro and Levaquin for an infection that didn't go away. It just wouldn't go away. And I said to my doctor, "What's in there? I just want to pull it out." And he goes, "Can you cough into a cup?" And I was so sick. I'm like, "Of course I can cough into a cup." And it came back showing Pseudomonas. He said, "How did you get Pseudomonas?" This is an example where he was a family doctor, that the primary care doctors are not keyed into how you can present as an adult with cystic fibrosis. So he put me on IV tobramycin, just one med, to take care of the Pseudomonas, and said, "I really want you to see a pulmonologist." So I went out of town a couple of hours to the east and worked with a pulmonologist who screened me for everything, identified bronchiectasis, referred me to an ear, nose, and throat physician for my sinuses, and did sweat chloride testing, and genetic testing. But the genetic testing was first. He found just one mutation, did the sweat test, which was 120, which was very indicative of CF, and gave me a diagnosis based on that. Now I am on very low dose of modulators. I had quite a journey with modulators when Trikafta first became available, and now I'm on a small dose and right now doing well. And the health issues at my forefront are ones that are consequences of aging. I guess that's a good thing.
My next big break was that I came across a paper that was published by a University of North Carolina doctor, Dr. Michael Mills. And he had published a paper about two sisters who he diagnosed late with CF in their 20s because his lab had found the second mutation. It was a rarer mutation, so they had two mutations. And I thought, oh my God, this is it. This is us. So I called him up, and he agreed he sent us all little boxes of blood, and I drew everyone's blood, and he tested it. And then that's how I found out. I was actually 32, but I didn't officially get diagnosed at a CF center until months later. So, but I knew at that point, and my sister and we were so ecstatic and we celebrated. It was wonderful.
A few weeks into the pandemic, then into the shutdown, I decided to ride my bike to manage stress. And I got about a mile out on the trail and had my first episode of hemoptysis. And although that was very scary and traumatic, it was my ticket in to see a pulmonologist in the city where medical care meets a higher standard. And he diagnosed me with bronchiectasis and MAC. But then I developed MRSA in my lungs. And so for the next 2.5 years, every 6 weeks, I was on an antibiotic chasing the MRSA. And of course, it did no good. I just became sicker and sicker, and the ID doctor told me that there wasn't much more they could do for me. I became severely depressed. Finally, I was tested for CF, and here I am today, saved by Trikafta. It was a relief to me to get the diagnosis because I knew there were treatment options.
We had all the kids tested for their mutations at that time. We found my unusual mutation, and then I proceeded in learning how to adapt all of those things in my life. And I'm a health educator, so I sent packets of information to each of my 4 siblings, and like they weren't so much interested. Some of them had yet to have children marry, and I think only one of my sisters ever got tested. So I feel a little discouraged, but I think they growing up, my health issues were really all about me. And I think they had trouble expanding their view to see it as a family disease that had something to do with them.
So from the pulmonologist, I went to the adult cystic fibrosis clinic at the University of Minnesota, now Fairview, Minnesota Fairview. And I've been receiving terrific care ever since. And the past 5 years have benefited greatly from modulators. And and yeah, so that's my story. And I'm sticking to it.
My life is pretty awesome right now. We are able to travel. I stay physically fit by going to the gym and participating in group exercise classes, and I still ride my bike on the trail. I didn't know it was possible to breathe this deeply. I do have lung damage, but I have normal lung function, which I feel very guilty about very often. I've had no more episodes of pancreatitis since taking Trikafta. Aging is my most serious problem right now because it's impossible to tell with every new ache or pain or symptom whether that's due to aging or to CF. Those of us in this age group, I think we live in kind of a gray area.
I wish that doctors would understand depending on the age of the doctor, they may or may not know that late diagnosis does occur. And so that's the key, that it occurs at any age, from any background, any race, any ethnicity, any country. It's been described everywhere. So just to be open-minded about that is the key. Newborn screening will not catch everybody. That there will be people who will be missed because they'll have rarer diagnosis and the test is not sensitive enough to pick up the rarer diagnoses. So don't discount somebody young who's got the symptoms, who had newborn screening that was negative.
I wish that the medical community as a whole understood that you can be diagnosed with CF at any age and that it affects the entire body, not just the lungs.
There still are physicians who say, yeah, it looks like you could have CF, but you're too old. Or what other reasons, and I'm not going to refer you to the CF clinic because I don't believe you have CF. So keep persisting. And I think people are very creative about either finding a different doctor or calling the CF clinics themselves. If you call the CF clinic, they'll listen to you. But it takes a lot of courage, I think, to have the presumption that it's okay that you've got CF and it's okay to call the clinic. But the clinics are happy to see people whether the outcome is CF or not.
The advice I give somebody who suspects that they have cystic fibrosis or really any disease is to seek out support groups and to find out and talk to people who have that disease and really try to get a better idea of, well, maybe yes, maybe no, who are the people I should go to.
Keep digging and don't take one provider's write off, well, it couldn't be that. It's got to be something else, Just keep plugging away and you'll get the answers.
If you think you have CF, just be persistent until you can find someone to test you. And if you have CF, you will learn to do some really hard things, but you'll also learn that you're a very strong and resilient person.